Have you been struggling with your sleep and stress and wondering if you should take ashwagandha? Well, before you go out and buy some, you need to watch this video as ashwagandha is not right for everyone. I'm Dr. Vara, triple board certified physician in family, obesity, and lifestyle medicine with additional training in functional and integrative medicine. In today's video, I'm going to go over what ashwagandha is, how it works, what the research actually shows, who should and should not take it, and the forms, dosages, and how long you should take it for. There are timestamps in the description below. So what is ashwagandha? It is a small woody shrub native to India and North Africa. Its botanical name is Withania somnifera. Ashwagandha has been used for over 3,000 years in Ayurvedic medicine, and it was given to children, adults, and the elderly to improve resilience and increase longevity by improving stress, sleep, inflammation, and immune support. It belongs to a class of herbs called adaptogens, and adaptogens help modulate your cortisol so that you are more resilient to stress. And there are different types of adaptogens. There are stimulating ones and restorative adaptogens. Ashwagandha is a restorative adaptogen. The active compounds in ashwagandha are called withanolides, and these are concentrated in the root of the ashwagandha plant. The concentration of withanolides in a supplement is what determines its quality and clinical potency. So how does ashwagandha work to help you feel less stressed and sleep better? There are two defined mechanisms that have been validated so far. So number one is by modulating your HPA axis. Your HPA axis stands for hypothalamic pituitary adrenal axis. This is your main stress response system. When the brain senses stress, the hypothalamus signals the pituitary, and the pituitary then signals the adrenal gland, and the adrenals will release adrenaline and cortisol. Then cortisol feeds back to the hypothalamus and the pituitary to say, hey, we have enough cortisol. You can turn the stress response down now. In short-term stress, cortisol is helpful. It mobilizes energy by raising blood sugar and helps your muscles be ready for that fight or flight. But under chronic stress, that feedback loop can become dysregulated, and the brain and the pituitary may become less sensitive to cortisol's stop signal. So the HPA axis keeps firing more than it should. This is where ashwagandha may help. Ashwagandha doesn't erase cortisol, and you wouldn't want it to. Cortisol is essential, but in other people who are under chronic stress, studies suggest ashwagandha can help lower elevated cortisol and support a healthier stress response system. The second way that's been defined is it modulates GABA. Ashwagandha appears to modulate GABA receptors. GABA is your calming neurotransmitter. It helps your nervous system shift out of chronic fight or flight and back into rest and digest. This is one reason why people report reduced anxiety and improved sleep when they take ashwagandha. In fact, they are studying it for perimenopause because one of the first hormones that decline is progesterone, and progesterone also modulates GABA naturally. So if you have less progesterone, you're not going to get the same relaxation. Since ashwagandha also modulates GABA, it is a potential treatment for perimenopausal issues with sleep. But they are still studying it right now. This GABA receptor is the same receptor that benzodiazepines work on. And those are meds like Xanax, Ativan, Klonopin. These are controlled meds that can be very addictive. However, ashwagandha binds at a different site on the GABA receptor and doesn't activate the brain reward centers and craving centers like the benzos do. So that's why dependence and withdrawal hasn't been observed. So is ashwagandha effective, and what does the research actually show? The strongest research and strongest evidence lies in terms of the effects of ashwagandha and stress. A systematic review of 9 randomized controlled trials involving over 500 patients found significant reductions in both perceived stress scores and serum cortisol compared to placebo, with cortisol dropping anywhere from 11 to 32%. But the reduction may depend on dose and form and the population. Other benefits are primarily from small studies. It may help with anxiety, and the data is promising, but it's not perfect. Human trials suggest ashwagandha may improve anxiety symptoms on validated scales, and it has even been provisionally recognized by psychiatric guideline groups as a potential supportive option for generalized anxiety disorder. But I would frame it as supportive. It is not a replace for therapy or medications. So make sure you work with your mental health professional or your primary care provider to determine if ashwagandha might be something for you. There also is data on sleep. A meta-analysis of 5 randomized controlled trials found that ashwagandha produced small but significant improvements in sleep, including total sleep time, sleep efficiency, and how long it took for people to actually fall asleep. The effects seemed strongest in people with insomnia who took at least 600 milligrams a day for 8 weeks or longer. But it was a small study and we still need more long-term safety data. There is some encouraging evidence that ashwagandha may support exercise performance and recovery. In human trials, it has been linked to improvements in VO2 max, which is basically how well your body takes in and uses oxygen during exercise. And it is one marker of endurance and cardiovascular fitness. Some studies also suggest it may reduce exercise-related muscle damage and improve recovery. Some studies show ashwagandha may increase thyroid hormone levels, specifically T3 and T4. Now, for people with subclinical hypothyroidism, which means your TSH is high but your T3 and T4 are normal, this may be a benefit. One well-designed randomized controlled trial in patients with subclinical hypothyroidism showed that ashwagandha raised T3 and T4 and brought TSH down back toward normal range over 8 weeks. But one study is not enough to call this proven, but it is promising given that ashwagandha's effect on cortisol. Since chronic cortisol elevation is known to suppress thyroid hormones, then ashwagandha, by lowering cortisol, might help raise your thyroid hormones. But it is important that you work with your primary care provider because if you get too much thyroid hormone, that can be a problem. Beyond stress, anxiety, sleep, and recovery, ashwagandha has some interesting early data, especially around male fertility in reducing inflammation, improving cognition, improving blood sugars, some menopause symptoms, as I mentioned, and on improving your immune function. But this evidence comes from in vitro studies, animal studies, or small human studies. So there still needs to be more research on that. All right, now this next part is very important. So who should not take ashwagandha? Number one is people that are in stage 3 HPA axis dysfunction. I have videos on the stages of HPA axis dysfunction, or AKA what we used to call it back in the day, adrenal fatigue. But people that are in the last stage, they are pretty much burned out. They do not have much motivation to get up in the morning, and they are just exhausted all day long. So if you are in stage 3, these people have pretty much burned out their cortisol. So if you take ashwagandha that further lowers your cortisol, then you're going to feel worse. I absolutely do not recommend it in this stage. There are other adaptogens that would be more appropriate. Contraindication number 2 is if you're pregnant or breastfeeding. We just don't have adequate safety data to know if this is safe. So if you are pregnant or breastfeeding, do not take ashwagandha. Contraindication number 3 is hyperthyroidism or Graves' disease. This is where you make too much thyroid hormone because, as I mentioned earlier, ashwagandha may increase your thyroid hormones. And if you already have hyperthyroidism or Graves' disease, your thyroid levels are through the roof. And this can be very dangerous because hyperthyroidism by itself can increase your risk for atrial fibrillation, which is a heart arrhythmia that can increase your risk for clots and strokes. It can increase your risk for osteoporosis, where you could be at risk for fracture, and also at risk for thyroid storm, which could be life-threatening. So if you're already in that state, you definitely don't want to take ashwagandha if you have Graves' disease or are hyperthyroid, because it might set something off to where you go into AFib or thyroid storm, and you don't want that. Contraindication number 4 is more of a cautionary, but if you have Hashimoto's thyroiditis. So in theory, because you're not making enough thyroid hormone, you would think maybe ashwagandha might be okay. But because Hashimoto's is an autoimmune disease, you don't want to do anything that's going to excite the immune system more. So even though ashwagandha in some small studies may show some good immune support, But if you already have an autoimmune disease where your immune system is already overactive, you don't want to activate it anymore. There's so many other adaptogens that you could take. I would probably avoid ashwagandha, but work with your healthcare provider. Contraindication number 5 are pre-existing liver conditions. There have been documented case reports of liver injury linked to ashwagandha. This appears to be rare, but when it happens, people may develop itching, jaundice, dark urine, pale stools, nausea, fatigue, and abdominal discomfort. Symptoms have been reported anywhere from about 2 to 12 weeks after starting it, but timing can vary. So if you get any of these symptoms, it's important that you stop ashwagandha right away and you report it to your healthcare provider. So some of the compounds in ashwagandha, including those with analytes, have been studied for potential liver effects. But in real-world cases, liver injury is most likely related to dose, the product quality, and contamination, and also if you have pre-existing liver disease. If you already have a pre-existing liver disease, like hepatitis, cirrhosis, significant or advanced fatty liver disease, or you just have elevated liver enzymes and you don't know why, or if you've been on other herbs and they cause liver injury, then I would not recommend starting ashwagandha. Contraindication number 6 is autoimmune disease. When you have autoimmune disease, your immune system is already hyperactive. And if you have one that isn't well controlled, then ashwagandha may theoretically worsen symptoms. It also could interfere with some of the medicines that are designed to suppress your immune system. So if you have lupus, rheumatoid arthritis, multiple sclerosis, inflammatory bowel disease such as Crohn's or ulcerative colitis, and you're on an immunosuppressant or biologic medication, then definitely discuss it with your rheumatologist first. Contraindication number 7 is nightshade sensitivity. Ashwagandha is part of the nightshade family. So these are the same plant family as tomatoes, peppers, eggplants, and potatoes. But if you are super sensitive to nightshade fruits and vegetables, then you want to be cautious with ashwagandha because it may also cause similar symptoms. So it's not an absolute contraindication, but it's definitely a caution. Lastly, contraindication number 8 is if you have really low blood pressure or low heart rate, because ashwagandha may lower your blood pressure and your heart rate. So how do you take ashwagandha? What are the forms and the dosages? So not all ashwagandha supplements are equal. There are 2 forms with the strongest clinical evidence, and those are KSM-66 and Sensoril. These are standardized extracts with their own patent, and so when you get ashwagandha that says KSM-66 or Sensoril on the back, then you know you are getting a standardized dose. If you look on the back and it says one of these 2, then you're likely getting true ashwagandha that may actually make some sort of difference. If it doesn't say it, kind of iffy if you're actually getting ashwagandha or if you're getting contaminants, even if you are getting ashwagandha. So you want to be very careful. Most of the studies were done with using the KSM-66 form. The KSM-66 form is taken from the root of the ashwagandha plant, and it's standardized to at least 5% with analytes. So many of the trials on stress, cortisol reduction, testosterone strength, and performance have all used KSM-66. It tends to be a little bit more daytime friendly because it supports your stress resilience without making people feel too sleepy. So it's often discussed for morning dosing and daytime stress support or exercise performance, and also for people who feel stressed but also tired and depleted. Sensoril is made from both the root and the leaf of the ashwagandha plant and is standardized to a higher withanol concentration, often around 10%. It tends to be dosed at nighttime because it tends to be more of a calming effect. It's often discussed for relaxation, evening stress, sleep support, or for people who feel wired, restless, or overstimulated. It relaxes you. Everybody's different, so when you try a new supplement, you should always try it on a day where you don't have a lot going on, so you can make sure that you're not getting groggy or having any side effects, because ashwagandha is a calming adaptogen. If you're sensitive to herbs or medications or supplements, then even the more daytime one might still make you sleepy. So the other things that you want to look at when you're looking at any supplement is just to make sure there's third-party testing, which means that an independent company comes in and makes sure that what they're selling is actually in the supplement, so you're not wasting your money. There are also other organizations that have certain criteria guidelines like NSF certified or USP verified, but you want to make sure that you are getting a good quality supplement. You also want to avoid leaf heavy blends. So, the Sensoril has a combination of both the root and the leaf, and it has a higher concentration of the withanolide, so it's effective. I would avoid proprietary blends because if they don't specify the actual milligram amount, you have no idea how much you're getting. Those usually aren't very potent, and so you may be wasting your money. The other forms that you want to avoid are generic ashwagandha root powder without any standardization because you don't know what kind of contamination with metals might be in there. Gummies, it is hard to get a therapeutic dose in a gummy. Most gummies don't have enough of the substance in it. So what is the therapeutic dosing range? In clinical studies, they found that 300 to 600 milligrams per day of the standardized root extract was effective. So morning dose at 300 milligrams may support cortisol rhythm, daytime energy, and stress resilience. And the evening dose at 300 milligrams supports sleep and reduces nighttime anxiety. So you could do a split dosing or you could just do it once a day, just depending on what you need it for. Make sure you discuss it with your healthcare provider. Side effects, GI upset, especially if you take it on an empty stomach, but usually once you eat, it's better. Can cause drowsiness, especially if you're at the higher doses. Occasionally it might cause headaches or emotional blunting. And then, like I mentioned, it may cause liver issues. So you want to make sure that you're monitoring for those symptoms and you want to get some baseline liver labs to make sure you don't have a problem before you even start it. I usually recommend to my patients that if they do take it, just take a break after 8 to 12 weeks, just so that you don't lower your cortisol too much. And I like to actually rotate adaptogens. So I like to do one for a couple months and then switch to something else. My favorite adaptogen is holy basil. I take that myself and I like it very much. All right, so that's all about ashwagandha. Drop a comment below and tell me, have you ever tried ashwagandha and what was your experience? Let us know what brand do you use, especially if it did work for you or if it didn't. I'm always curious to know. And if you haven't subscribed yet, please hit that subscribe button. Thanks for watching. If you're watching on YouTube or listening, if you're listening to the podcast version, and have a fantastic day.